Dear students, I am Prabhavati SN. In today's episode, I will be talking to you about the second part of vitamin C. In part 1, already you have learnt about the history of the discovery of the vitamin and its importance in various physiological role. So, in the second part, you will be studying about the factors which are considered in arriving at recommended dietary allowances, the major physiological roles, disorders resulting due to deficiency, diagnosis of deficiency and the bioavailability of the vitamin, and treatment of deficiency disorder. Moving on to the recommended dietary allowances, ascorbic acid is essential for proper absorption and utilization of non-heme iron. To obtain the benefit, both ascorbic acid and iron must be consumed at the same time in same meal. It is very important that the RDA has to be kept at a level that is just considered to be sufficient enough to promote the absorption of non-heme iron and for the prevention of scurvy. After thorough evaluation of the available evidences, the committee has decided to retain the earlier recommendation as it is for all the age groups except for pregnancy. Now let us define the requirement. Generally, the requirement is determined by depletion and repletion studies. To cure scurvy, the minimum daily intake is as low as 6.5 milligrams. The levels required for leukocyte saturation after a complete depletion has been found to range between 10 and 20 milligram. However, the ICMR has fixed 40 milligram as the daily intake based on the assumption that about 50% may be lost during cooking or storage of foods. The requirement for various age groups is discussed as follows. Adults, the minimum requirement has been determined based on controlled human experiments. Medical Research Council UK carried out studies and showed that about 10 mg ascorbic acid should be taken daily for curing scurvy. Urinary levels have been found to fall rapidly, but the clinical signs and symptoms of scurvy appear only when the body pool has reduced to less than 30 milligrams. The absolute minimum amount needed to cure the condition is 6.5 milligram per day. The requirement for ascorbic acid among Indian adults is mainly determined on the minimum intake needed to maintain vitamin at saturation level in leukocytes. When leukocyte was saturated with large doses, it was seen that for some subjects an intake to maintain these levels, while among others it showed a decline. When intake was increased to 20 mg, saturation was found to be maintained for about 100 days. Based on these results, the committee recommended an intake of 20 mg per day. Considering the losses occurring during cooking and other processing techniques, it was fixed at 40 mg per day. Pregnancy. No recent data is available to indicate that ascorbic acid requirement should be increased during pregnancy. Demand from the growing fetus will be too small. Hence, extra allowance is not needed as the normal recommended levels ensure a sufficient safety margin. However, the committee has suggested an extra 10 mg per day during the entire course of pregnancy to facilitate for the accumulation and to meet extra demands of the growing fetus, particularly in third trimester. Accounting for the cooking losses of 50%, the RDA has been set at 60 milligrams per day. Now let us study about the requirement during lactation. Based on the level of secretion of ascorbic acid in human milk, the additional needs to be met during lactation are calculated. Healthy, well-nourished woman may secrete 700 ml milk per day with an average ascorbic acid content of 3 milligrams per deciliter. With this assumption, the committee has fixed an additional requirement of 20 mg per day. Hence, during lactation, the total intake per day is fixed at 80 mg. For infants and children, a daily intake of 25 mg for infants has been suggested by earlier committees, assuming that breastfed infants would receive good amount of ascorbic acid. For children, about 40 mg per day has been suggested. Now let us learn about the major functions of vitamin C in the body. Collagen formation. It is a major structural protein found in connective tissue, bone, teeth, cartilage, skin and scar tissues. It is formed from a precursor protein called tropocollagen via a hydroxylation process of proline and lysine respectively within the tropocollage. These hydroxylation reactions proceed only in the presence of vitamin C. Impaired vitamin C status results in defective collagen synthesis, which impairs the process of wound healing, disruption of capillaries, faulty bone and tooth formation. The primary effects of impairment in collagen synthesis is manifested as small pinpoint hemorrhages as a result of weakness in the membranes that generally forms the lining of the blood capillaries. This leads to escape of blood into the enlarged intercellular spaces, resulting in capillary bleeding, which is commonly observed in scurvy. The other noticeable effect of impaired collagen synthesis is defective bone matrix formation, leading to impaired bone mineralization. As a result, the bones are displaced from their joints. Role of vitamin C in carnitine synthesis. It is a nitrogen-containing organic compound which takes active part in the transport of fatty acids into mitochondria for oxidation reaction. This in turn releases energy for utilization by the body cells. Neurotransmitter synthesis. It is essentially needed to sustain the activity of the copper-containing enzyme dopamine oxygenase. This helps to catalyze the oxidation of dopamine to synthesize the neurotransmitter norepinephrine. In the process of biosynthesis of serotonin, vitamin C is known to play an active role in the hydroxylation of tryptophan. This is indicative of the fact that brain and adrenal glands contain high amounts of vitamin C. Vitamin C is also known to be involved in the activation of certain hormones. Several hormone releasing factors are produced as precursors, which needs to undergo enzymatic modification in order to activate them. Hormones such as bombacin, calcitonin, gastrin, oxytocin, thyrotropin, corticotropin, vasopressin and growth hormone releasing factors are essentially dependent on vitamin C for their activation. Under stress conditions, high levels of ascorbic acid are known to be present in adrenal glands. In the synthesis of corticosteroid hormones, vitamin C is needed for the hydroxylation reactions. Vitamin C is also known to take part in cellular respiration. It is known to play a vital role in the electron transport chain. The optimum activity of cytochrome oxidase would take place only in the presence of ascorbic acid. Vitamin C also facilitates tryptophan metabolism. During the synthesis of serotonin, the hydroxylation reaction converts tryptophan to hydroxyltryptophan by the enzyme hydroxylase. For this particular reaction to occur, the presence of vitamin C is considered to be very essential. Vitamin C also has a vital role in immunologic function. An enhanced synthesis of immunoglobulins and phagocytic action of leukocytes occurs when vitamin C is present at optimal concentration. It also helps prevent cataract. It is known to significantly reduce the risk of cataract formation. It also plays a major role in metabolizing the cholesterol. The enzyme 7-alpha hydroxylase plays an essential role in the synthesis of bile acids from cholesterol. An enhanced level of synthesis can be expected to occur in the presence of vitamin C. It is also involved in the maturation of erythrocytes. It is helpful for the conversion of methemoglobin to hemoglobin. Ascorbic acid is needed for the degradation of hemoglobin to bile pigments. Along with tetrahydrofolic acid, ascorbic acid also is involved in the maturation of erythrocytes. It promotes drug detoxification. Within the body system, vitamin C is essentially needed for the optimal activity of several drug detoxifying metabolic systems. The mixed function oxidase system and the flavin monooxygenase system in the liver can function effectively when vitamin C is present at an optimal concentration. It also acts as a general antioxidant. Normal metabolic processes in the body results in the production of a wide variety of harmful oxidizing agents. This mechanism is also being observed when there is an increased exposure to drugs and to environmental pollutants. Several enzymes and antioxidant reducing agents such as vitamin E, beta-carotene and vitamin C are capable of converting these oxidizing agents into harmless substances, which can later be excreted. Vitamin C helps in scavenging many types of oxidizing free radicals. Vitamin C is also involved in the regeneration of reduced form of vitamin E, which is again a well-known antioxidant nutrient. It also helps to maintain the structure of blood vessels. It prevents tissue damage and hence the development of cardiovascular disease via its antioxidant property. It also helps in iron metabolism. It acts as a reducing agent which helps to keep ferric ions in ferrous form and facilitates optimal absorption. Vitamin C is capable of forming soluble complexes with ferric ions, which is beneficial for preserving iron solubility at duodenal region under alkaline pH. Vitamin C is also involved in the transfer of iron from blood plasma into ferritin, which is a storage form of iron in the liver. It also facilitates the release of iron from ferritin as and when required. Vitamin C is known to assist the process of absorption of calcium via preventing its incorporation into complexes that are mainly insoluble in nature. One of the unique functions of vitamin C is that it converts inactive form of folic acid to its active form dihydrofolic acid and tetrahydrofolic acid respectively. It also promotes the stabilization of the active form of the vitamin. Now let us study about the disorders resulting due to vitamin C deficiency. The severe form of vitamin C deficiency is manifested as scurvy, which is virtually very rare throughout the world. Improper cooking practices and low intake of fresh fruits and vegetables have been considered as the major causative factors of dietary deficiency of vitamin C. The early symptoms are said to be non-specific, which may include listlessness, fatigue, weakness, shortness of breath, muscle cramps, aching in the bone, joints and muscles, and loss of appetite. Adult scurvy is characterized by swan neck or corkscrew deformity of the hairs during the early stages. Scurvy is generally characterized by gingivitis, petechiae, arthralgia, depression, postural hypotension, and inability to perform strenuous work. Delayed wound healing is also seen due to lack of synthesis of connective tissues. Hemorrhages can result in anemia. Pinpoint hemorrhages have been said to occur when total vitamin C reserves fall below 300 milligrams. Now let us discuss about the effect of vitamin C deficiency among infants. Firstly, it causes tender bones. This condition is very evident in the legs. Due to this, the leg may assume the typical frog-like position. Occurrence of petechial hemorrhages. The bursting of capillaries due to its brittleness gives rise to the formation of red and purple spots over the body. Gingivitis. It is a condition in which the gums have a tendency to bleed due to spongy swellings in the mucous membrane. Delayed wound healing. Failure of the cells to deposit collagen fibrils on the wound surface results in delayed wound healing. Cessation of bone growth. The bone growth is restricted. In epiphysis, the cells continue to proliferate but without a new matrix between the cells. As a result, bones are susceptible to fracture easily due to defective ossification. Children are also known to be affected by anemia and pyrexia. Having studied about the deficiency disorder, it is very important to know about its diagnostic criteria. Diagnosis. Depletion studies in healthy volunteers provide substantial information regarding the assessment of status. A drop in the plasma level of ascorbate to 7 to 11 micromoles and below within a period of 4 weeks with a supplementation of diet either completely devoid of vitamin C or with 10 mg vitamin C per day. It was also noted that about 14 weeks elapsed before the appearance of scurvy. In contrast to this, the levels of vitamin C in leukocytes were found to fall gradually after providing depletion diets for 14 weeks. A level of 6 to 11 micromoles per liter in serum indicates poor dietary intake of vitamin C and is said to be a probable risk factor associated with the occurrence of scurvy. The leukocyte ascorbate levels are considered as the truer indicators of vitamin C status. The total concentration of vitamin C in WBC is proposed to be a better reflection of tissue stores of vitamin C. Plasma values less than 11.4 micromoles per liter indicates the risk of developing deficiency. Further, a level below 6 micromoles per liter is indicative of high risk. Currently, ascorbate levels are being measured using colorimetry or liquid chromatography. The tissue ascorbate availability can be measured by leukocyte ascorbate concentration and are thought to provide more accurate reflections of the available tissue reserves. Concentration greater than 86 micromoles per 100 ml WBC is said to be associated with normal status. Below 40 micromoles per 100 ml is indicative of depletion. The most preferred assay would be the plasma ascorbate concentration. Since vitamin C can be obtained from only the limited sources, it is important to know its bioavailability. Bioavailability can be defined as the proportion of nutrient that has been absorbed by the intestine, in turn which is available for various metabolic processes within the body. Studies on animal models have demonstrated an enhanced uptake into adrenals and spleen when flavonoid-rich juice or a purified plant flavonoid was present in the diet. Pharmacokinetic study in guinea pigs demonstrated that there was about 148% increase in the overall concentration when a citrus fruit media was used. A delayed plasma vitamin C uptake was noted with respect to citrus fruit as against rapid uptake demonstrated by the synthetic vitamin C. Human studies have provided considerable evidences on the extent of bioavailability. Among patients with scurvy, the plasma levels were found not to increase when only synthetic vitamin C was supplemented. A gradual improvement was noticed when vitamin C was given in the form of lemon juice. Recently, it has also been demonstrated that a greater relative uptake was noted in human skeletal muscle in comparison to leukocytes. Vitamin C provided as a supplement would require about 2 hours to reach maximum plasma concentration after being ingested. With respect to citrus fruit media, a still longer time was needed to reach maximum concentration. In a study, 500 mg vitamin C was supplemented to volunteers either with or without the citrus fruit extract. It was noted that the presence of citrus fruit tended to delay maximum plasma levels by 1 hour and resulted in an increased bioavailability to the extent of 35%. The 24-hour urinary vitamin C excretion was found to be increased in participants who were pre-saturated with vitamin C. On the other hand, a decreased excretion was recorded in not saturated participants. This is suggestive of the fact that the baseline vitamin C status of an individual is the major determinant affecting the comparative bioavailability. The bioavailability from tablet formulations has also been investigated. As per the results, it can be said that a dose of up to 2000 mg per day are considered to be safe for consumption. But pharmacokinetic studies have revealed that when intake exceeds 200 mg per day, it tends to reduce the rate of relative bioavailability. Data on tablet formulations have showed that slow release formulations to exert enhanced bioavailability. Next, let us learn about the treatment of scurvy. Scurvy can be cured with as little as 6.5 mg of ascorbic acid daily, but a dose that is required to correct the deficit and to replete the body stores, an individual must take 100 mg ascorbic acid 3 times a day. The manifestations of scurvy often tend to recede promptly, and in some cases dramatic changes can also be seen. With ascorbic acid supplementation, the symptoms would disappear within a few weeks. Subjective improvement is most commonly known to begin within 24 hours of providing supplementation. The other symptoms such as lethargy, anorexia and pain would disappear completely in 2 to 3 days. The problem of swelling in the joints could be resolved in a few days' time. The skin lesions with purplish color would quickly subside in 2 to 4 weeks, whereas the brown pigmentation takes quite some time to disappear. The hyperkeratosis decreases in 1 to 2 weeks. Changes in the gums might be seen after 1 to 2 weeks of supplementation. Complete recovery might take 3 months. The increase in the reticulocyte count is expected to increase substantially within 10 days in anemic individuals. Hematocrit values would return to normal range within few weeks of treatment. For maintaining normal vitamin C pool in the body, it is important to include vitamin C rich natural foods like fruits and vegetables in the daily diet. Fruits like guava, orange, lemon, sweet lime should be consumed in abundant amount. Now let us conclude today's episode. Vitamin C is one of the most essential nutrient. Though it is needed in small quantities, it has been credited to play a wide variety of physiological functions. The basic function of vitamin C is to promote the synthesis of collagen. It is also needed for facilitating proper assimilation of iron in the body. Deficiency of vitamin C can lead to scurvy. The common manifestations include bleeding gums, pain in the joints, petechial hemorrhages, etc. The condition can be very efficiently treated by providing vitamin C supplements. As a long-term measure, it is suggested to consume vitamin C rich sources such as citrus fruits and other fresh vegetables for preventing the occurrence of vitamin C deficiency